Breast cancer.
Breast cancer.
Breast cancer.
Breast cancer.
Breast cancer.
Breast cancer, more common than you think. About every 15 seconds, a woman is diagnosed with breast cancer.
Cancer is equal to death.
It's already, you're dying.
I took shampoo in my hand. All my hair was sitting on my shoulder. They all came down at once. That was a disaster day for me.
I knew that I had breast cancer. It was very difficult for me. I feel that I'm blinded. There is something black in my life.
Why me? Why am I getting breast cancer?
My chemo is 16 sessions. My hair is already falling down. My son cried, "Ma, I don't want to lose you." You don't see it coming.
We brought together survivors who lived and fought through this disease. Hear their stories that may help save a life.
There are so much advances which can really make a difference.
You need to know what you're dealing with.
You're not alone in this fight.
Breast cancer is more than one type. If you have a lump, don't be panicked. Most of the lumps in the breast are benign. That means they're not cancerous. Don't be quiet, don't be shy. Come to us. But please go for doctor to check.
For the expert doctors, the fight is clear.
Breast cancer awareness is throughout the year. It's not only in October, not only in November. It should be throughout the whole year. Even though October is finished, awareness is not.
You give them hope and faith. You make them believe it. There are people who have beat this sickness and they come out.
So this takes me 4 years in the past. My son, who's 18 today, it was his 14th birthday. There was a party in the house, all his friends were over, and I, like a busy mom, was arranging his birthday party. Well, we had a fun and a blasting birthday party. By the time everyone went home, it was late, around 3-ish in the morning. I was tired, went to bed. When I turned on my left side, I felt a kind of a pricking pain in my left breast towards the side. Now, I'm a nurse and I know a breast pain, what it can turn out to be. So I just touched my breast, but I was so tired that I didn't want to go in any further details at that point of time. Touched my breast and I felt a very evident lump. But because I was so tired, went to sleep. Next day morning, I woke up and I asked my husband. He said, "Yeah, there's something bumpy here." I was getting ready to go to work. So we decided, okay, let's go and get it checked. I was very skeptical to get it checked. As a human tendency, that fear that you don't want it to turn out to be what it could turn out to be. But I got a call from my surgeon and she said, the news is now good. The report has come and it is invasive duct carcinoma. And you will have to go through. And then she started explaining me the whole journey. I just could not fathom the fact that, why me? Why am I getting breast cancer out of nowhere? Right now, I'm at the kind of pinnacle of my career and I want to progress more. This is going to kind of stop my life, my career. And, how am I going to cope up? There were 100 of thoughts naturally that was boggling in my head. So Tony actually responded and reacted very strange. 3 days he did not speak to me. All he did is he was sitting in the garden. He was not even looking at me in my eyes. He was not talking to me. And can you imagine, as a woman, the biggest support that you expect is from your husband, but your husband is kind of ghosting you now. And I'll tell you the reason for that. My husband Tony has lost his mom to breast cancer. So he probably was trying to relate to that. Am I lost my mother? Am I going to lose my wife? So a lot of things. But my family stood like a pillar. We all got together on a table and I made Tony break the news to the children. My kids told me, "Mama, don't worry. It's okay. You'll get treatment. We pray for you. We'll fight this together." So there was a lot of uncertainty in my mind that, okay, now that will have to go through this journey, will I be able to sustain? Not everybody body is strong enough to sustain and to be able to tolerate chemotherapy. It's not an easy treatment. I don't know, I somehow feel cancer targets everything that a woman would cherish as a compliment, as a feminine beauty. It targets everything. Your hair, your nail, your breast. I mean, come on, name it, and you have it.
Most of the lumps in the breast are benign. Yeah, that means they're not cancerous. If a lady notices a lump, the most important thing for her to do is not to panic. Just make sure that you are really feeling a lump. This is what I would say. Check the other side. Make sure that this is really a lump. Is it there? Can you feel it also on the other side? If you're kind of sure that yes, no, I feel a lump on this side, then get it checked up. Book an appointment to a physician. If the easiest one to you is a general physician, yes, but I would advise a general surgeon. So what we do is when a lady comes to us, we take a full history of the patient. We ask if she has any risk factors. So if lifestyle, habits, family history, we ask all these things. And then we examine the patient. So after examination, careful examination, then we would ask for an ultrasound or a mammogram or an MRI, depending on the clinical scenario that we are facing. At that time, the usual thing is that sometimes this radiological ultrasound, mammogram, or MRI would suggest, yes, this lump needs a biopsy, or this lump is totally benign and we can monitor it.
The most important aspect is this early identification. So if you identify a cancer early, the less likely to spread further. The surgeries would remove the crux of the problem. Then we add additional treatments to it to get the better benefit out of the results. So if you got a hormone receptor positive, which is the most common cancer, hormone receptor positive, early breast cancer, surgery and additional treatments like the hormone therapy will take care of the cancer in up to 90 to 98% of patients. So there are some the aggressive forms like the HER2 positive, triple negative breast cancers, which are notorious in that they do behave quite aggressively. Even after surgery and the chemotherapies, they still could come back. The treatments are advancing in that we are always finding a way to get ahead of these situations, improving on the treatment and hence the results.
We have stage 0, which means some changes in the cells in the breast. It's very early. We can excise by surgery. That's it. Cure rate 98%. And these changes can be detected only by screening mammogram. Stage 1, small lump. Stage 2 and stage 3, lump in the breast, but it moved. It moved to the underarm. So you will have breast lump and lymph node under the armpit, in armpit. Stage 4 means no, spread in different organs, spread in the liver, in bone, in lungs, because we know our enemy. We know that cancer, if left not treated, if detected very late, it can go anywhere in the body. Small lump, 2 centimeters, can have some very bad, very aggressive cells that can go outside in the lung, in the liver, in bone, in brain, while the breast lump is still, it's 2 centimeters. So the chance of waiting for symptoms, waiting to feel a lump, no. Yeah, screening without any feeling of any problem in the breast, no lump, no pain, nothing. So the chance of cure will be higher, much, much higher than feeling a lump.
I went home after the chemotherapy, went into the shower, opened the shower, and I took shampoo in my hand. And I'm trying to put shampoo on my hair, and all my hair was sitting on my shoulder. They all came down at once, not even strand by strand, or not even in bunches, all came down at once. That was a disaster day for me. And I called my husband and I said, look what happened, why there is no hair on my head, where is all my hair? I remember Tony took me, he wrapped me in a towel, brought me out. He told me, okay, let's dress up, let's go to the salon. And the moment they saw me, they understood. And then the lady in the salon kept saying, there's no trimming, we need to shave. Obviously, me as a tough woman, I said, don't you dare shave my head, I want hair. While I was arguing and, quarreling with this salon lady, there was this another woman sitting in that salon looking at me through the mirror, complete stranger. And she was wearing a cap and looking at me, and when I had an eye contact with her, she just removed her cap and showed me her bald head. She came to me, she held my hand and he said, my darling, it's okay. Let them shave your head. And that moment, I realized that, this is a part of the journey, and that is where this whole concept of cosmos comes. The moment someone who is my kind, someone who's going through the same journey, a stranger came to me, held my hand, and told me that, let it be, I was convinced. And that is the beauty of a support system. Anyone battling cancer, undergoing treatment, how much of work productivity can an individual give? But me, that was a year I was promoted.
In October 2024, I knew that I had the cancer, breast cancer, level 3. It was very difficult for me, really very difficult. I feel that there is something blind. I feel that I'm blinded. There is something black in my life. It means how I will do, how come, how I will work, what I'm going to do. Should I stop? Should I continue work? Should I sit at home? Should I sit at a hospital? Everything. A lot of 100 questions I'm going to find the solution for all this. I had a small lump, but I feel pain sometimes. It's not daily pain, but sometimes it's like electricity. So it means your body is showing you that you have to do something. I will not say that it is good experience for anyone, but what to do, alhamdulillah, all is good now. Honestly, the doctors, the way they are talking, I feel that there is nothing. Yeah, the first doctor I meet, she is the general doctor. She said, you have to do this test. Then after that, you have to do another test. It means step by step, till I hear that I have cancer. This doctor, she really was amazing doctor. The way she's talking, I feel it is very simple thing. Because the doctor from the beginning, he told me that maybe we are going to remove all. I told him, okay, no issue, doctor, remove whatever you want. He said, normal for you? I told him, normal, doctor, just remove the all. Whatever you are going to remove, it is, if it helps me in my health, do it. Don't think about how people is going to look at me. Think only for my health only, that's all. Other thing, no.
So if you find a lump, first I would say, don't panic. After that, come to us, we'll get it checked out. And most probably, if there is a lump, we're going to require or request an ultrasound or something else to check it out and look for it, how it appears on the ultrasound or other radiological, investigations. You need to know what you're dealing with. Am I going to keep the lump and just, monitor it? Is it safe? Am I just going to remove the small lump, just the lump itself? Or is it a cancer and then it needs, some other kind of management? And surgery and management for each is different.
Cancer treatment is not always one treatment alone. It is always a multidisciplinary approach where a group of doctors involved in the diagnosis, treatment in various forms, surgery, radiotherapy, and the chemotherapy, all those doctors sit together to see that reports of that particular patient and the way it had come into our attention, and decide what is the most appropriate way to proceed with the treatment.
If more than one in the family having breast cancer, the risk is high because genetics are shared in the family. So they should know that if they have any positive family history, they should be under screening, like women. For sure, if obese, because fat increase the estrogen level. And we have about 70% of breast cancer depend and love estrogen. So if in patients who are obese, the risk of developing breast cancer is more. For sure, also, I think most of the audience know that alcohol, smoking increase the risk of many types of cancer, including breast cancer.
By the time I hear that I have this sickness or this disease, I'm thinking a lot of my son. If something happened to me, what will happen to him? It's a little bit, it means I'm thinking for my family more than myself.
Did you tell your son?
No, at all. Till now, he doesn't know. But he is clever. Sometimes he knows that I have something like this. My son, he is very sensitive. Very, very sensitive. So I will never tell him this thing. For him, his mom is a very strong person. I will keep only this image on his mind. That your mom is a very strong person. That's all. Other things, no. Even my mother and father, I didn't inform them on the first time. I informed them exactly when I was to start my first chemo session. It means after 3 months.
How did your husband take the news?
He take it very simple. He is the one who encouraged me at that time. He take it very simple. I will not say I didn't cry or I didn't not shock because I will be liar, very big liar. But the way he talk, that why? What happened to you? It's very normal thing. And it was really very normal thing. I start by chemo sessions.
How many sessions?
Like 17 sessions. After that, I did my surgery. Then I did my radiation. And now I'm finishing my chemo sessions and some injections for support in life. By the chemo sessions, they minimize the cancer, they make it very, very small, like it's almost gone.
We may be thinking like females only will be getting breast cancer, but it is not like that. Males also get breast cancers. Breast cancer, we can be broadly divided early breast cancer and locally advanced breast cancer. And another part is a metastatic breast cancer. Metastatic means already it has gone from the breast to other part of the body, which we cannot give a full curative Indian treatment.
In 2008, 2009, we know that breast cancer breast cancer is more than one type. We have 4 types of breast cancer. We have breast cancer hormonal, depend on hormone. We have genetically, depend on certain gene, it's called the HER2 gene. Other will not depend on hormone, will not depend on genetics. And the 4th one depend on that gene and on hormone. So everyone has its own treatment, its own prognosis, its own response. So now it's much less that the treatment will not be effective because you know your enemy now. Before we don't know, but now we know.
All the people, they said, no, after chemo, you have to sit, you have to sleep, you have to do, don't do like this, you are killing yourself. But for me, I believe if I sleep, if I take this rest, if I believe that I cannot move, I will not move. The time I believe that I can move and I have to move, it's very easy for me.
So you kept working even during...
Yes, I kept working. I didn't stop at all.
And how did you feel when you lost your hair?
This is comic, by the way, what I did. The doctor, he informed me, you are going to lose your hair after the first session. So I go to the salon and I remove my hair directly without waiting that it will fall. That's what I did. I don't want to see my hair fall. I want to take it like I am the one who will do. So I do it. If any person has the same issue, if she is going to do like this, she will take it in another, because she will love her face, she will love herself in the mirror, because she is the one who takes the decision. It's not like something, oh my God, what happened to me? No, I'm the one who takes the decision. It's changed. It should be like this. By the way, I sit in front of my husband like this, and he said, you are really amazing. Without her, you are really amazing. And all the people who knows me, they like me without her, better than with my hair.
You have a stage for breast cancer. It was like a death sentence some years back. Even now, with how much the treatment has advanced, we have so much very comfortable treatments in the form of pills, which can be given, which will control the cancer and can extend their life to an extent which was unimaginable 10 years back.
Cancer is not this much big thing, by the way. Cancer now is normal thing, because everything now is developed. The medicine, how they are treating cancer, the doctors, everything is now, you feel that it's normal thing. But you need a supporter. You need a supporter. Someone who to support you, or someone who really will stand near with you in this duration. It's very, very important. For me, if my husband was not here with me, I'm sure I'm not going to get this power. If no one have an idea about what is happening to me and hearing the positive vibes from people, I'm sure I am not going to be in this power at all. Alone, how I am thinking, how I can fight alone. It's not possible at all. So any person who have cancer, he needs to inform someone with him, at least one, because there is after chemo sometimes it's really hard to stand. So if there is no one with you, you cannot stand.
In the Philippines, I am a retired teacher for 25 years. But here, I am 17 years. I really love children, really. It's maybe in my heart that I really love them, even though they are stubborn, hard-headed. But for me, I know because children are a gift from God. I was diagnosed by carcinoma malignant breast cancer last year, 2023. My chemo is 16 session. It's my 2 session that my hair is already falling down. So that day after my chemo, I went to the salon and then to be shaved. So I am bald, but I am not ashamed. Even though I am in school, I am not ashamed. Even the children, if I am in the playground, they will come to me and say, Miss Lynette, can I touch your head? So they will touch my head and then they will ask me, Miss Lynette, when it will grow and it will grow. So that's it. And then comes after my chemo, I need to have a radiation. It's a 25 session radiation for every day. I am very, very grateful for the people who stand by my side, who support me, not only a support, but with their love and then with their time, especially the Aster medical team. They give me strength, and all the nurses there. Imagine a chemo, it will take how many hours sitting down, but for me, no. Because in my mind, I need to fight. I have a family waiting for me in the Philippines. My son cried. He is a man, but he cried because he really loves me. Because in the Philippines, when you see cancer, it's already, you're dying. So when my son knows the news, he cried and cried, "Ma, I don't want to lose you." "No, I will survive. I'm still here." My husband also react, and then yeah, I know he is sad. He will lose a lovely wife. But I told him, "No, I will survive for you, because as we grow old, we will be together." So, and then my grandchildren, I really love them, because I told them, you are my strength. Before I apply in Dubai, I was with my sister. I already noticed with her that she has a lump on her breast. It is right or left. I can't remember. And then she will just tell me, it's okay, because it's my hard carrying, because her job is, they have like a land where it's lots of fruits. So selling to another places, yeah, like that, you know what I mean, carrying baskets. So her daughter called me, "Tita, you need to talk to her, because I know she will not stay." So when I called her, that is what she told me, that it's already very, it's already what term you can say, that it's already malignant, and it's already in a critical stage. So I said to her that accept it, and then we will pray for you, whatever. So that's it. Then after a week, she passed away. As a cancer survivor, every time I'll do my healthy living, and then it's a cry, it's a tears of joy, because I know this is now 2 years that all my laboratories are all normal. So all of that, I'm very thankful to those people really who supported me.
Actually, I have one patient I cannot forget. She presented to me, she's 42 years old. She presented to me in 2021, at the time of Corona. She presented very weak on wheelchair, very pale, gasping, like taking, she has shortness of breath. She cannot talk, extremely ill. And when I examined the patient, I found a big lump in the breast, bleeding. By examination, I feel that there is water in the lung, and I know breast cancer can develop water in the lung. And she is well educated, very well educated, and having a very good job. I asked her directly, "What's happening? Why you are late? You have a breast lump and it's bleeding." She told me, "Because I am afraid of chemo. I don't want chemo. I visited many doctors and they told me chemo, but what I know that chemotherapy is dangerous. I will die from chemotherapy." Then I tried to explain simply, no, chemotherapy, we have very good supportive treatment. Death from chemotherapy before, because no immunity injection, because the patient will have vomiting, extreme vomiting. Now we have very good medications to prevent vomiting. For example, we have one tablet, it will protect from vomiting for 5 days, only one tablet. By the way, this patient visited other doctors, not specialized, not oncologists. And they told her family that she have only 3 months to live. Take care to her family, to her country. She accepted the chemo. She received the chemotherapy, and then surgery done to remove the bleeding lump. All the water disappeared. We started after chemotherapy some targeted therapy, which is new advances in our treatment. Tablets she will take during work, during her daily life. And now she's completely free. Completely free. Every scan, nothing in the breast, nothing in the lung. And now it's almost 4.5 years. She's completely fine. After she recovered, she sent to me this message, was a gift actually, in my birthday, saying that your birthday fell on the day of my surgery, 25th October 2021. And I couldn't let it pass without expressing my gratitude to the Lord for the miracle He has done in my life. I will cry. Every time I read it, I will be affected. Thank you for the gift of you and your smile that eased my first appointment. O, outstanding medical expertise. H, heartwarming care that made feel safe. A, amazing approach, attentive, positive, and admiringly humble. Truly unlike any other oncologist I have met. Still the best doctor for me and my tom yum friend, because I like tom yum soup like her. I really miss you, Doc, with love and prayers, Rep.
Losing your mom is one of the greatest pain you can have in a lifetime. And you are always, as a child, you're always the most connected person to you will be your mom. So that had in its own impact on me as a sort of patient person. I took some time to recover from that kind of a loss, because my mom was young. She had a rare, difficult kind of a cancer situation called as inflammatory breast cancer, which is one of the most aggressive form of breast cancer that had gone to the brain. She did fight it with such strong spirit, and she went through it for 2.5 years with the best quality of life she can achieve in that circumstances. And even though we knew and we were prepared, and I was in this situation where I know what is happening, still such losses are difficult to comprehend or accept that situation. And my mom, one point in time, did tell that this must have been the reason why you became an oncologist. What I talked about in my mom's case is if you got 1,000 to 2,000 breast cancer patients, you might have one of those kind of breast cancer of that type. So it's a very rare kind of a situation.
You're broken glass, but the light that goes through you lighten each other. So all of us, we are broken inside one way or the other. But if you can use that and turn it into power, it will help other people. Even though someone is dying, you give them hope and faith. You make them believe it. There are people who have beat this sickness and they come out. A support group is good that even though someone has given up, they'll be like, okay, there's hope. There's someone still outside there giving me hope, knowing that I need to fight. Because sometimes when you set your mind, be like, I've lost this fight, definitely you lose it. But if you have, even though one person believing in you, you can still have the strength to beat it. We heal through healing other people.
Cosmos is actually my brainchild, and I'm the one who initiated it. When I was coming for my chemotherapy, I've noticed so many patients. They used to come alone and go home alone and cry alone. Nobody was there for them to even come and encourage them that, please eat this. It's important for you. And that is where, my heart, was broken, that who's there for them? So many of the patients, don't even have the courage. If they are expatriates and their families are back there in their home country, they don't want to even break this news to their family back home, because the distance will make it worse for them to process this information. Cosmos will make sure that no one fights cancer alone. Someone should always be there for you.
We've had patients in our clinic who are young, who are maybe 13, 14, who presented to us with breast lumps. So it can be there, even at younger ages. I'm not saying that we should really worry about them, but we should notice them. We should bring them into attention. And this is how we educate our kids, by educating ourselves. Yeah. So if we know what self-examination is, if we know what normal breast is, so as kids and get into puberty and they start developing the breast, we should educate them. What is normal? What is abnormal? So when a child notices something abnormal, they would come back to their parent and inform them that, Mom, I think that I can feel something. If you can just check it out, or, if you can see if, what I feel is true or not. And then if the parent is educated, or, I mean, is aware of these kind of things, then she would say, okay, yes, let's go visit someone. So I think that's the key.
After 40 years of age, every woman should have annual ultrasound and a mammogram to look at if identify if there are any problems appearing in the breast. You're not alone in this fight. At this point in time, there are so much advances and medical knowledge and experiences which can really make a difference in not only curing the cancer, but also maintaining that near normal quality of life.
If anyone having lump, man or woman, before forming lump, get screened. And if you have a lump, don't be panic. Most breast lumps are not cancer. But please go for doctor to check. And please stress on your doctor to start treatment very early. Still, I have some patients coming with big lump because they feel it from years, 1 year or 2 years, but they are afraid of knowing what is the problem. Deep inside, they know, but they fear. So if you fear, really the chance of cure is much less.
We can never emphasize enough about the importance of breast cancer awareness. It is a disease that has impacted a lot of women in the past, that has led to a lot of, unfortunate incidences. But we have noticed through medicine, through the recent advancement in all aspects of medicine, in chemotherapy, radiotherapy, in surgery, in cosmesis, that a lot of ladies can reach to cure from this disease. Yes, the only key and the only importance is early detection. And this is why we're doing all this awareness. We want ladies to detect if there is anything abnormal with them, to be detected early. We want them to break this barrier of silence. Don't be quiet, don't be shy, come to us. Come to us and we'll address this together. We'll look at it together. We'll see, maybe you don't need anything. Maybe you just need to go a little bit further. We need to do an ultrasound, a mammogram. Sometimes we need to do a biopsy. Sometimes we need to go the whole way. But we're there with you.
So my one message is to the ones who are in the journey of fighting this disease: fight hard. You will overcome. And don't give up. All that it takes is help your doctors to treat you well by only doing one thing. Stay positive here.
For everything, when you wake up on the morning, don't think at all about any negative thing. Even if you have a very, very big problem, forget it. When you wake up on the morning, think only for the positive thing. Whatever problem you have, try to forget, especially in the morning. Because the morning is the start of your day. If you take anything negative, it will continue negative till I don't know when.
You need to be positive. You have a positive mindset. And the first thing you're gonna do is to accept it. You need to accept it with all your heart. You know what I'm doing every time I need to give up? I pray. And then my family, my husband, my children, and they are all in my mind. Because in my mind, I am telling, I will fight, I will live, I will fight, I will live. In Tagalog, it is called laban. Laban, don't give up.
It's important for ladies not to think that only October is the month of breast cancer awareness. Yes, breast cancer awareness is throughout the year. It's not only in October, not only in November. It should be throughout the whole year. So, getting out of this October zone or October month is an important message to ladies that, even though October is finished, awareness is not.